Innocents dying preventable deaths. This is Law and Society. Please subscribe. Today I will briefly talk about this horrendous thing that is happening all around the world. Children are dying preventable deaths. And, I was watching Katie Couric's interview with the Pulitzer Prize winning journalist, and I forget his name, but if you go on Katie Couric's YouTube, that interview is on there, and he's talking about how there is widespread famine and starvation in countries like Sudan and among the Rohingya population in Bangladesh who fled Myanmar, and other places in the world where there is famine and starvation. However, the most visible one to us, which I believe stands proxy for all of the others, is what is happening in Gaza, where children are dying and there's famine that is essentially manufactured. It is a famine that is being imposed on the people of Palestine by choking any aid that can get to these people. No matter what excuses are being thrown, whether coming from the Israelis or whether, others claiming that, Hamas is stealing aid or whatever the case may be, the end of the story is that children are starving. So much so that somebody who doesn't have basic humanity or decency like Donald Trump saw the pictures of the kids and the infants in Gaza and said, yeah, they look hungry. I mean, it's a basest way of saying things, but they are starving, they are malnutritioned, they are down to their bones. And there is this blockade of aid not going to them, and they are dying because of it. Whatever that reason is, whether it be the government of Israel or the international community's lack of urgency that is causing it, that aid needs to be released so the children stop dying out of starvation. And that goes to the bigger story in how, not story in terms of how we as Americans under Donald Trump's regime have given up the fundamental duty that we had to the less privileged in the world. Our U.S. aid program that was less than 1% of the budget provided for food aid and healthcare aid to stop diseases like HIV through the U.S. aid program, and it saved millions of lives every day. Millions of lives every year. About 3 million lives every year was saved by U.S. aid. And that is not only did that give us, I can't believe I'm saying it in past tense, not only did that give us a soft power, a sort of diplomatic advantage in those countries, but it also did a lot of good for a lot of people through the aid of health that was provided. Maternal mortality rates went down. Infant mortality rates went down. Cases of HIV went down. However, with the retraction of aid by 87% in the U.S. aid program, a lot of these aid programs have been shut down. And that was shut down when Donald Trump decided to disband U.S. aid. And the money has been frozen. And so the deaths are already occurring. This journalist talked about the death of a 5-year-old orphan who was HIV positive from birth, who was living because of the treatments that was available through the program, the USA program. And because the medicine stopped coming, he caught an opportunistic infection and died. And just sort of swinging from that horror story to maternal clinics closing, and then all around the world where there was no other access to maternal reproductive health programs or facilities, where that aid provided by U.S. aid made it possible, and now it's no longer available. So we will learn the real number of deaths caused by this next year, because not even the people who were supposed to keep the numbers were kept on these jobs. They were just shut down, so much so that thousands and thousands of pounds of food aid are rotting in warehouses across the United States and abroad, burning millions and millions of food aid because they have expired, ordering to burn millions and millions of dollars of contraceptives that can be easily given to aid agencies. All of these they can be given to nonprofits throughout the world. If you are using the aid program, if you're part of U.S. aid and the money and the products had been purchased, why the commonsensical way would be to, okay, fine, we're just going to give it away to these aid organizations because we're stopping these programs. No, the Donald Trump's regime let them rot in the storehouses while paying the storing costs, and did not provide the aid, did not give out the contraceptive care. In the United States, we're going to see the beginnings of the massive cuts to the food SNAP programs and Medicaid and to environmental safety programs. We're seeing rollback of EPA regulations, rollback of admission of greenhouse gases being a contributor to the climate crisis. All of this is being rolled back, and the money from SNAP being taken away, the money from public health departments across the country being taken away, the money for preventative care from state-run programs being taken away, funding. There still may be those programs in states that can afford to keep it, but federal funding is going away for that. The hell that the irresponsible ending of USA did to the world will happen on an acute level in the United States, where American children and American mothers will die unnecessary, preventable deaths because of the neglect of Donald Trump's regime and because of the intentional infliction of this sort of physical, emotional, medical help. It is diabolical in the way that it's happening. We are seeing children die all over the world, and that calamity is coming towards the United States as well. Thank you, Donald Trump. Thank you to Robert Kennedy Jr. Thank you to Russ Vought and Stephen Miller and people who are promoting these programs. Innocents are dying preventable death because of active, intentional cutting of necessary funds where children and people and mothers and sick people, the neediest among us, are being deprived of the basic sustenance that only costs this 1%, globally speaking, USA speaking 1%. And then nationally speaking, a big chunk of American healthcare is being cut out. A big chunk of food assistance is being cut out. Environmental programs that keep our air and water clean are being torn down. The stops that the previous administration put on stopping fossil fuels from depleting our planet even more, exacerbating the climate crisis even more, therefore threatening future generations and children born now with an existential climate crisis. That is happening by Donald Trump is subsidizing fossil fuels and saying drill baby drill, while taxing renewables, which even in states like Nebraska contributed to 40% of their energy. But you have the Secretary of the Interior, former governor of Nebraska, saying that solar panels have this cataclysmic failure when the sun goes down, thereby sort of telling the people this absurd lie that, this obvious thing in front of us, that batteries have been storing energy for our phones and our computers and our electronics for quite a while. So the idea of storing electricity in batteries is not a novel concept. But under Donald's regime, even Batman, whose state draws 40% of its energy from renewables, is spreading disinformation about the weaknesses, alleged weaknesses of renewable energy. So let's put our frame of mind in a place where we can be compassionate of those who are needy, who are in need, and who need help. Let us focus on that. Let us raise our voices so the necessary aid programs that would protect the world against extreme starvation and preventable deaths by diseases like HIV and tuberculosis and other measles, these are preventable deaths. We have now a measles outbreak happening in the United States, bigger than in the last 30 years. And that is something that we need to worry about. And Donald Trump's regime is deliberately pulling itself away, taking away taxpayer funding for these very necessary programs domestically and internationally. Not just in the short term, in the acute pain it's causing by the deaths that are preventable, but also by compromising our future and compromising by exacerbating our climate crisis that we are responsible for, scientists have said over and over again. We need to talk about this. We need to put our attention to this, that children are dying at very alarming rates through preventable deaths, acutely in Gaza, but also in Sudan and in Bangladesh and in Rohingya camps and in other parts of Africa. And health programs are shutting down, whether it be in states by cutting state Medicaid money, or whether it be in the international community where there is not even a proper maternal center for maternal health. We need to raise our voices and become aware that we are living amongst this suffering. With that said, thank you so much for listening. Please share and subscribe, and I'll talk to you soon.